All right, wrapping up our discussion of quasi-experimental designs, a multiple time series design actually builds on the time series design by adding a control group, so that um, helps improve the validity of the study, particularly the internal validity. Um, and so what you have here is you have multiple time points at base, before the intervention is implemented, and then multiple time points afterwards. And the difference is now you've added in a comparison group, which is established through a method other than randomization. All right, now we're going to talk about observational study designs. And the four types that we have are cross-sectional studies, prospective cohort studies, retrospective cohort studies, and case control studies. Now, these are on the lower level of the hierarchy of evidence, or the pyramid hierarchy. So it's lower level evidence, not that. So it's a little bit more prone to bias. And the way they define these is sometimes also by the direction of investigation in time. So the first one we'll talk about is a case control study. These are retrospective studies where the starting point is after an illness has begun, or after somebody has been exposed to something. And it begins with cases of people who have this disease and control patients who have identified through a retrospective chart review or a retrospective audit of those who do not have the disease. And then they compare the outcomes between the groups in terms of prevalence of the disease. And they report those as the odds ratio. It certainly has a number of advantages because it's fast and inexpensive. And it's especially common when you have very rare diseases. And you don't have to worry about tracking patients down and following up with them in a prospective study. But it is very prone to recall bias, vulnerable to selection bias as well. And you really cannot calculate true incidence data. You can only estimate the prevalence of disease, in which case you can only report the odds ratio with case control studies. The next type is a prospective cohort study, and this is where you're interested in understanding determinants of some sort of disease. And so it's a plan to design to answer questions in a very specific area. You have non-disease subjects meeting eligibility criteria are enrolled. You get detailed baseline information on lifestyle, demographic characteristics, and exposure is collected from each, and then they're followed over time. So you're following a cohort or a group of people. So in this example, maybe they're following 117,000 nurses who did not have cancer, and then they enroll them and assess exposures at the baseline, and they're wanting to understand the determinants of heart disease. And then after time has elapsed, the investigators will collect follow-up data from them and compare the incidences of heart disease. And they can even then go break the group down into those that were obese and those that were not obese. So that's an example of a prospective cohort study. There's some disadvantages that they can be expensive to complete. Only appropriate for for common diseases, and you can certainly be at risk for that threat of mortality or loss to follow-up. So these type of studies tend to need very large sample sizes. Um, but the advantages is it's less vulnerable to recall bias because you're continuing to follow these patients over time. And there's usually non-biased selection of cases and controls, and testing, diagnosis, exposures, and measurements are usually standardized. And the big thing is you can really calculate the true incidence of a disease, and most of the time they'll be reporting the relative risk of that particular disease. A retrospective cohort study is essentially you're following a same cohort of people, but you're looking at them retrospectively back in time. And so in these cases, the study was not pre-planned, but the investigator has to go back to the pre-existing data that was not necessarily acquired in a precise, predetermined way, and follow-up may have been incomplete. So the cohort in this example would be employees of a tire manufacturing company, and they're interested to see, do chemicals used in tire manufacturing increase the risk of death? So they're actually having to go back in and look at health records of employees between those that were exposed to these chemicals and those that were not exposed, and they're looking at the incidence of death. In this case, that was their outcome. A cross-sectional study, this is what you commonly see with survey type designs, or a census or a poll. And these are very common in prevalence type studies, where you're just basically getting a single snapshot in time. You can't really, as downside is you cannot establish a trend either before or after the survey. And there is what they call a healthy worker bias can result, which is an effect or a factor that may appear to be absent, but in fact those present for the survey may be due to the illness, especially in a workplace survey. Meaning, in fact, so you may only have, when you do a cross-sectional study, if you can't capture everybody, the whole population that you're interested in, you may only be getting those people that are healthy or actually more likely to respond. And so the example of this one was the study that Dr. Doman did a few years ago that was published in the ANA, which looked at call shift fatigue prevalence rates through a electronic survey method, and then went through and did some regression analysis to identify predictors of call shift fatigue based on some of the respondents' answers to the questions. If you want a nice overview of analytical studies, you can go to this website here. Feel free to pause the video and write down the link if you like. I've also included a couple of YouTube videos that were listed at the beginning. They're also saved up on SharePoint that you can go to, that'll provide you probably a much better and succinct description of these studies than I could give you. All right, we're going to keep pressing on here. We're going to talk about collecting data. So now that you're, when an investigator is designing a study, they have to think about what data do they want to collect. And a lot of times that's driven by the study design, the research question, and an understanding of the type of extraneous or confounding variables that they may need to control for to improve the internal validity. Also the timing of when they're going to collect their data. And so these are, when you're reading a research manuscript, these are important items to look for. Virtually every study should have some sort of a demographic or clinical data if it's like an anesthesia research study. You can see some of those listed here. And so what they will have is you'll have what's called an operational definition, which is essentially what that means is how you're measuring that particular variable. And what we have here is they've even gone a step further and encoded. So when they're recording the data, they might just, a subject might just complete a questionnaire, a data collection form, and circle male, female, but then that research coordinator is going to use a code that they're going to enter into their database so they can do the statistical analysis. And you can see I have listed here some of the different levels of measurement for each of these type of variables. And we talked about some of this in the last lecture. The last one on the list would be, some of you may not be familiar with, but this is military rank. And as you get more senior in rank, it's a rank ordered because it's military rank, and so it would be considered ordinal level data.